There's a place in Uganda called Abim district, is in Karamoja. I work at the capital, that is Kampala, Mulago Hospital, and specifically Uganda Cancer Institute. While I was at the Cancer Institute, I was working as a physician. The highest level of training I'd achieved was residency in internal medicine. I see internal medicine, this is really, there are categories of specializations for the doctors after the medical school. One can go to do surgery, that's cutting. Mm-hmm. The next one is obstetrics and gynecology, that's women. And then the other specialization is pediatrics for the children. Then the medical conditions in the adults that do not necessarily require operation, those ones, the specialists study internal medicine. Blood disorders, for example, that's what I've come to study here. Neurology, studying of the brain and those other things. Gastroenterology, kidneys, rheumatology, that's what the internal medicine training helps us to achieve. The fact that there is a big gap in the field of hematology, and especially at the Uganda Cancer Institute, and the interest that I had to pursue this discipline, I was identified, and then I came to McMaster University. My family being back home is a motivation for me to really study hard, go back home, work hard for them. And they always tell me, hey, read hard, and I tell my daughter, hey, I'm reading, you also read. There's a lot that I have to take back to my country in terms of the skills I'm going to learn from here, given the fact that this discipline is not taught in itself in Uganda. Uganda is such a small country with a population of about 36 million. And that's the population, I'm told, almost is of Canada, but Canada is so huge with all these medical workers, and the ratios of the doctors to patients back in Uganda is overwhelmingly really so high. The healthcare professionals are very few. What I learned here that I would take home definitely is to actively look for the disease so that they don't come late. If we can catch them as early as the people here, that would be good. We need to go and tell the people to come for regular checkups, because of most diseases here are also caught up pretty early because of these regular checkups, which is not routinely done back home. Anyone else who would really, if they ask me whether they should join IOP or not, I think I would say I will not hesitate to recommend them to come to IOP.